So Lori, thank you so much for being willing to do this interview with us today. It's we've been working together for a few years now, and it's been a pleasure working with you. Would you mind telling us a little bit about your background and what your role was when we worked together?
Sure. I work in healthcare, and so I was with a hospital, and I've been there about 17 years. Started as a system analyst, and when we engaged with Phase 3, I was in a role as the testing manager, overseeing all of the testing activities for our several initiatives, which was a merger with another hospital, as well as implementing a new EMR. And so I was the testing manager over that, as well as interface manager.
I remember those days. It was you had a lot of different hats to wear.
Well, you helped me wear the hats, so that was always nice.
I appreciate that. It was a pleasure working with you. I think that it was, looking back at those times, it was intense, but it was good to work together. So I remember the situation back then. I mean, how would you define the situation before we started working together when you had all that on your shoulders without Phase 3?
It was a little chaotic when we first started merger testing. We didn't have a real clear direction. We didn't know where to start. We didn't have an assessment of all of our equipment. We didn't have an assessment of all of our systems. We didn't know what basically we didn't know what we didn't know. And so engaging Phase 3 was really very smart on our part, because it allowed us to have someone be that directional point and tell us, here's where you are, here's where we need to get to, and here's the path to do that.
Kind of like a GPS, it sounds like.
Yes, very much so.
Yeah, it's funny that you say that. You can have a lot of expert people in the room, but unless you have a clear roadmap or a clear where you are and a plan to move to your destination, unless you track that and keep that up front and center, it's easy to get lost in the weeds.
Yes, for sure.
All right. I mean, how did you feel back when things were chaotic like that, and you were being pulled 1,000 different directions? What did that feel like?
Well, again, the word chaotic always comes to mind, but I remember feeling lost and unsure, and just no real clear understanding of what we needed to do, or no real clear understanding of how to get started to get to it, because the project was so massive.
No, it's hard to really. They say the only way to eat an elephant is one bite at a time, but when you're facing the elephant and worried about getting trampled, it's hard to think about that, right? I mean,
Exactly.
those are massive programs, and it was a challenge. And I think people, I know you always want to do you always do quality work. You're committed to excellence, but sometimes it's just overwhelming when you got
Right.
so much going on and it's not clearly defined.
Exactly.
What was it like working with Phase 3 on your projects? Once we were engaged and we started working with you and getting that GPS going, what was it like?
It was a relief, actually. You guys came in and put us at ease right away. Very professional, very organized. You provided excellent tools for reporting and tracking and keeping us updated with status. Nice report cards, showing us where we were at, and percentages of how much more we needed to do to get to where we needed to be, kind of thing. So it was just a real relief to have that direction.
Now, I love having a dashboard. I'll tell you,
Yeah.
I love working with you, and as we develop those report cards and dashboards. I think, as being a leader, and you were in charge of all the testing for those projects. If you don't have a clear dashboard, it's really hard to know what's going on. It's really hard to really have a handle on things.
Yes, I agree. And those were, especially important for senior management to be able to know what resources might need shifting in order to get work done. So it was very helpful to have all that stuff.
No, definitely. I think senior management doesn't have the time to read a lot, and so they need to have very clear dashboards, as you said, very clear report cards, so they can make decisions on the fly.
Correct. Yes.
And that was awesome. Yeah, that was a good time. What was your favorite thing about working with Phase 3? What made you happiest about working with us?
Just the ease and the true camaraderie, where you guys actually became part of our organization. It wasn't so much, here's a vendor who's working extra hours and trying to overcharge us. It was very much you incorporated yourselves into the culture. You understood what we needed, and you really became more like family than just another vendor.
We love that. Honestly, that's one of our favorite things to do with our customers. I love that you noticed that, because we do see ourselves as family. We see ourselves as we're all in this together. And working with people, what we found is when when you sincerely care about people and you really want them to succeed, that comes through and they can feel that.
Yes, I 100% agree with that.
Yeah, it's sad that so many vendors that are in the marketplace, so many vendors are just in there for the money, and they just come in to do a job. They don't realize these are people they're working with, and it's important to build those relationships and really care about the people you work with.
Right.
What were you able to achieve on those projects you mentioned with Phase 3 as your IT project managers? What did we achieve together?
Well, we came. Sorry, I can honestly say that we came in on time and under budget with all the projects that we engaged you guys on. And I remember specifically three big projects. One was a Windows 10 readiness assessment for all of our systems. And so, we had to go through all of our applications. We had to work with all of the analysts. We had to get quotes and specs and all that kind of stuff for what needed upgrading. It was a large project, obviously. There was also a readiness assessment for all of our applications that we had to do, and that was because we were going to be merging with another hospital organization. So what applications did we have that were in common? What applications were going to be kept? Which ones were not going to be kept? Sort of thing. How do we set up user security? Get their logins to them, get them, all that kind of stuff. And then also, you guys did the technical dress rehearsal for us, and that was really um, wonderful to have you guys just manage that whole process from start to finish, and you engaged multiple different departments to get all that done. And so really appreciated all that hard work with the inventory. And then we have all of that information organized and ready and stored electronically, so that when we need to go back and say, okay, how many PCs, how many laptops, how many printers, how many scanners do we have in this location, we would know. So that if we needed to replace scanners, we could say we have 4,332, whatever the number. We were always ready for that with that information based on what you guys provided to us. So fantastic outputs that we always got from you guys.
Well, thank you, Lori. We couldn't have done it without your help. I mean, it was definitely a team effort. I think as project managers, sometimes you're kind of the ringleader, but it takes a whole team back on the back end and the front end to make us successful. And we had that together. We were able to to work together. And like you mentioned, TDR, we had, I don't know, 20 people, 20, 30 people out in the field going around and doing those tests. And you're right, we provided a central electronic dashboard for them to put all their results in. But again, it was definitely something, we worked together as a family, as a team, and we were all in it together. And I think that camaraderie and rapport really helped us succeed.
Yes, I would agree 100%.
What would you tell someone who's on the fence about which IT project manager to hire, or who's considering Phase 3?
I would, obviously, I'm going to always vote for Phase 3 because you guys are the kind of company that does come in and adapt to the culture. A lot of times vendors will come in and say, this is my way and this is how you need to do it, and period, the end. But you guys came in and you assessed our need, and you assessed the situation and didn't tell us, you have to do it this way. You said, here are several options. Let's work together to find the one that fits the model for your hospital. And so that was refreshing and nice. And then you guys even would go outside the scope when necessary. And for instance, one thing that comes to mind, and I actually jotted this down so I would not forget, when we were getting ready to begin our testing, we had brought users in that were not from our facility and therefore didn't have their normal setup and logins and that sort of thing, and they were having trouble connecting. And you guys saw that issue and you immediately took action and figured out what they needed to be able to connect remotely, and you wrote up the instructions, and then you essentially trained our people on how to connect remotely to our own systems. And you did that based solely on seeing the need, not because we said, hey, here's a project we need you to manage. You just said, hey, I see a need, let me fill it. And so that was the kind of company you want to be working with, one who sees your needs and then helps you fix them.
Thank you, Lori. Yeah, I think that's the whole purpose. That's why you bring a consultant in the first place, is you have a
Exactly.
gap and you have needs that need to be filled, right?
Right.
And I remember that. I remember what happened there is, again, with being two different hospitals, two different networks at the time, there was some network controls, some firewall rules, and some other things behind the scenes that had to be done in order for that connectivity to happen. And one of the nice things, with Phase 3 IT, because we have an IT knowledge, we're able to do more than your average project manager. We're able to actually help you guys bridge those gaps, and with technology too.
Right.
So that was a great experience. Yeah, I really enjoyed working with you guys on that testing, and you did a great job too. I mean, on the testing side, I remember you leading that room of 200 people, 200 plus people, and you were the one that had to keep it all moving forward. There's a lot of people in those rooms and a lot of different opinions, and you kept things
Yes,
moving
there
forward.
were.
Well,
But
thank you.
together we got it done.
Well, Lori, you got it done, and you always have gotten it done, and that's why we love working with people like you. We love working with IT professionals and healthcare IT professionals who are committed to success and who just need a partner to help them get there. And we really enjoy working with you. Again, we couldn't have been successful without you, and we value your friendship and consider you part of the family.
Well, thank you. I appreciate that. I feel the same way about Phase 3 and you guys.